is renal disorder. We have got 2 cases. Out of this, both the cases we had referred for renal evaluation, and they had renal complaints. Once we had seen this feature, we took an X-ray. We confirmed that is nothing is there in the X-ray. There is just a fat deposit sort of feature, and we had sent both the cases for renal evaluation, and it had come positive. The patient had come to our OP back, and he had told a big thanks from the allopathy doctor. They had told it was a very unique finding. So these are all benefits that we can provide to the patient. We should definitely take the aid of diagnostic procedures. We can have a cross reference from a specialist, and then we can confirm the condition so that the patient may get benefited. How many of us, I hope we have come across, few of us might have come across this feature. It's a finger. It's the ventral aspect of a finger, and you can see unexplained, and it has spontaneously developed. People may tell something is there inside, doctor. Some rice, paddy or wheat sort of things are there inside. I don't know how it came. No injury had occurred. No pain is there. Nothing will be there. Nothing will be there. And if at all it develops beyond a level, it will start paining because of nerve irritation and muscle irritation. Nothing will be there. So be careful. If you see this feature, straight away refer the patient to renal evaluation, and then we can manage this by applying some good feed and labor. Now, calciphylaxis is another feature. A thrombotic vasculopathy due to calcium deposition in the middle layer of the skin arterioles. The lesion progresses to extremely painful with ulcer formation and necrosis. And this is not a hyperpigmented patch. We cannot just explain this case as a hyperpigmented patch. It is a necrotic area, and it will be painful many times. The patient will have pain on the peripheries of the lesion, and it is usually seen in the area where there is adipose deposition. This is again Kyle's disease associated with CKD, chronic kidney disease. Now, usually what happens is patients come to us with the diagnosed CKD, and they will come for treatment of this condition. They may just think it's because of mosquito bite, or it is because of some other external pathology, but it is our duty to keep a small lens, see a small bulging on the skin lesion, and also an exfoliated area in the center, and it is painful also. We can characteristic this. I have written that word umbilication. You can see that umbilication, a depressive area on the topmost lesion. If you see the topmost lesion, the skin is little bit bulged. The lesions are uniform, but there will be an umbilicated central area which is depressed. Central depression will be there. No doubt he is having CKD. But to our to our confidence level, for a person who is not so acquainted with managing the renal disorders, we get the case for managing the skin disorders. So how to manage is we'll discuss it in other time. But it is not painful, but itching will be there. And the commonest area that I forgot to tell, the commonest area is lower limb, that too below the knee, in the bony prominent area, shin area, tibial area. Porphyria. Porphyria is usually an associated condition in CKD. I will skip that because it's very rare in our practice, not seen here. I just wanted to just convey that there is a clinical condition called porphyria. Next, non-specific a few changes in the diagnosis or in the diagnostic approach. Pruritus caused by kidney disease is coming to nearly about 50 to 90% of cases. In a renal case, we can see near about 50 to 90% of cases who come with itching. That is because of urea deposits or uremic condition, or even the clinical condition which we discussed in a few cases, like that finger, like that foot, like that shin. All these presentations are usually associated with the renal disorders, and cutaneous changes secondary to pruritus, like excoriations, prurigo, and post-inflammatory pigmentation disorders, and lichen simplex. Lichen simplex. And in a chronic case of CKD, where the patient has already undergone hemodialysis many times, their skin will be extremely dry and very thin. They tend to bruise very easily. That is a single word. It is cirrhosis. Those three features are called as cirrhosis. Cirrhotic skin. Now this feature, we have accumulation of non-dialyzable substances. All these come and accumulate in the skin. We are still in renal disorders. We have not gone further. This is again a feature of chronic renal failure case, where there will be uremic frost even, that is a sort of powdery feeling over the skin. Powdery feeling over the skin. We can scrape the small powdery particles from the skin, and it is due to uremia. Nail changes. Half of the skin, half of the nail will be one color, and rest of the half will be another. Now let us not go for the technical terms because we cannot even pronounce, but they are seen in the clinics. Half and half nails are seen in the renal condition. And other, we all know, melanin pigmentation disorders in chronic cases of renal conditions, and changes like whitish, pale nails and brittle nails, and splinter hemorrhages. All these are features seen in renal condition. It's a repetition what we had